All right, it's that time of the morning. Welcome to the Health Hub. Right, you're live on Newsfeed AM, and now it's time for the Health Hub in collaboration with the Bhekisisa Center for Health Journalism. And Mia Malan, as always, is joining us in studio. Mia, it's always great to see you. Good morning. I watched last week as you were giving essentially feedback that you've received for the work that we do on the Health Hub, and that's really encouraging stuff. So with that in mind, what are we talking about today?
So we're going to look at why South Africa needs more Johnson & Johnson vaccine doses, and we're also going to tackle how to speak to teenagers about sex, and we're going to meet long COVID patients.
All very important discussions. But as always, we always need to give some kind of update around how we're doing on the inoculation front. So how many vaccines have we administered? And more importantly, how are the provinces doing?
So we have fully vaccinated about 1 out of 5 adults in South Africa. So that's about 20% of people of 18 and older. But there are actually 2 provinces that are ahead of that, and that is Limpopo and the Eastern Cape, as you can see. They have vaccinated almost 1 in 4 adults. And those provinces have done a lot of door-to-door campaigns to create demand for vaccination. And they've also traveled to really hard-to-reach areas and take the vaccinations to the people.
Really counterintuitive that it's the more rural provinces, it appears, that are doing better than others. But I've also noticed the Eastern Cape has now overtaken Limpopo insofar as vaccinating a larger proportion of their adults. Does that have to do with the Johnson & Johnson jab at all? Because we know that at least that dose or that vaccine only needs 1 dose for people to be considered fully inoculated.
So not really, because if you look at how many J&J doses each of those provinces have used so far, they've used more or less the same number of J&J doses. But what the Eastern Cape has really been good at is to form partnerships with rural NGOs to reach those hard-to-reach villages and take the vaccinations there. But actually, both provinces have struggled, Limpopo and Eastern Cape, because they haven't had enough J&J doses. So if you look at the delivery schedule, J&J is very, very far behind with their deliveries. We ordered about 31 million doses in February, and we've only received about 6.5 million of those doses. And if you look further at who have we vaccinated, fully vaccinated with J&J, or with of all the doses that we have administered, we've administered about 16 million doses in South Africa, and only about 3.5 million of those doses are J&J doses. The rest is all Pfizer. And the reason why that is such a big issue for us is that J&J only requires 1 dose, so it would be faster to fully vaccinate more people and reach a larger percentage of people vaccinated in South Africa if we had more J&J doses.
Yeah, I know people, for instance, who rock up to vaccination sites hoping to get a J&J dose because of what we've essentially just mentioned. You don't have to come back to be considered fully inoculated. So with that in mind, do we have some kind of, I don't know, consolidated list of where people can get a J&J jab?
So there's unfortunately no list that the health department has issued, but what we do know is that all our new batches will be going to either rural areas or to pop-up sites, because those are the 2 scenarios where it's hard to go and find people who had first doses and get them back for second doses. So you may have noticed many people had access to J&J doses in urban areas up until now, but that's really only because there were leftover doses that were used for essential worker groups such as teachers, and those doses expire by the end of the month. So when they were not used up fast enough, the health department gave them to almost any site that could use them. But when they run out, those doses will not be replaced.
Sure. All really important context. So one thing is for sure, though, we are in a situation where we know that there are more vaccines in this country than has ever been the case before. But that doesn't necessarily mean that our concerns around the pandemic are over. There's also this phenomenon you might have heard of called COVID or long COVID, right? I'm not going to do much of the explaining, but as a start, take a look at this. Here's some kind of message from someone who suffered from long COVID and what that's meant for them. Take a look.
I had COVID on the 6th of August last year, positive PCR test. I had very severe headaches, very severe fatigue, body aches, like I could not even get out of bed. I felt like somebody had beaten me with a bat. And 6 weeks later, I wasn't better. I was fortunate that I had a GP that knew about it, and he acknowledged that this could possibly be long COVID, and I've been a long COVID patient ever since.
Can you please tell me how your sickness has impacted on your ability to work?
The physical symptoms of being so fatigued all the time, you can't actually concentrate on your emails, on contacting your customers, on actually even functioning at home. I vacuum the house and I'm totally exhausted, and I don't live in a big house. It's impacted my work greatly. So I've had to adapt. It's very frustrating going from somebody who was active, not being able to do this. And it impacts your income at the end of the day.
Right, so that's a COVID-19 patient. Nina Kodat was in conversation with Bhekisisa's producer, Mohale Moloi, explaining essentially, Mia, the impact that long COVID has had on her life. But let's begin at the beginning, so to speak. What is long COVID?
So long COVID is when you experience COVID-like symptoms for longer than 28 days or for up to 28 days. And those symptoms can be new symptoms, or they can be the symptoms that you experienced in the first month of COVID. And very often long COVID patients get very tired, they have very bad headaches, they have shortness of breath, and they struggle to concentrate very much. But let's find out from another COVID patient what it is like to live with COVID. So Sarawat Ajam spent 106 days in an intensive care unit because of COVID, and a total of 6 months in Groote Schuur Hospital in Cape Town. He joins us on the line from Cape Town now to tell his story. Thanks for your time, Mr. Ajam. The day that you went to hospital, did you think you would have to fight COVID for this long?
Absolutely not. Initially, it was just a flu-type symptom, but I was well aware of COVID itself, and not taking the chances, though. When I felt worse after I've seen my GP the next day, I thought to myself, well, like the other lady explained, with your fatigue, your headaches, the weakness in your body aches and things like that, I immediately asked my daughter to take me up to Groote Schuur Hospital. And that's when I discovered that I contracted somewhere, I contracted this serious disease. And when I arrived there at that day, they just placed me in a wheelchair. I was wheeled in through the entrance, and I just collapsed. I blacked out, and that is the last I know when I was admitted to that hospital.
Mr. Abbott, tell us a little bit about your recovery journey. What kinds of treatment did you have to undergo to get to the point where you could be discharged from the hospital?
Well, being in the COVID ward, it was like just over 2.5 months. I was comatose completely. And during that period, I lost all muscle, the working of my muscles in my body. I became completely paralyzed. So here already, it was a seriously long journey for me. Not being able to move, not being able to help, not being able to speak. I've been on a ventilator. I was told having heart problems during this whole experience, having lung problems, developing kidney problems, and many other problems like diarrhea and acute pneumonia. I challenge these people at every single corner. And thank God, I have to say, firstly, all praise has to go to God Almighty for being so merciful and graceful. And secondly, I have to thank a great medical team that supported me and that never ever gave up. Never, and this is a thought that sits with me, that fought for my life really, in order for me to survive this pandemic. But like I said, the support in itself is absolutely great from every single division, and there were doctors from every single department and every single person.
Mr. Ajam, just hold that thought there. I want to ask you one more question before we run out of time. I would like to know today, what is your life look like? Do you still have symptoms?
You know what? After 6 months, the doctors, my doctor, the personal doctors, the two main doctors, Dr. Richard van Zyl Smith and Dr. Jenna Mercy, came to me and said to me, you know what, Mr. Ajam, today it is such a great delight for us to announce that you are completely COVID-free. And I was excited myself, really, really excited. And since then, I was so determined to get my life back together. Although it's a very tough journey, I was so determined to get my life back together. I worked extremely hard with the physio team, with the lung clinic, the aftercare, if I could say that. And I'm still seeing my doctors in the aftercare. They're still amazed at my current journey. And having that type of support made me feel very confident that I will make an absolutely complete recovery of this COVID, even though it is now, over a year and a half.
Thank you very much for time and sharing your story with us, Mr. Ajam. That was Sarawat Ajam. He is a long COVID survivor speaking to us from Cape Town.
Sure. Really heartbreaking, Mia, listening to Sarawat's experience. And it makes you wonder, given the level of care anybody would need if they were to suffer from long COVID, whether we even have that capacity in the form of institutions to deal with that side effect. Is that even the right term?
So we only have one long COVID clinic in South Africa. It's based at Groote Schuur Hospital. And we're actually going to, after this break, speak to the head of that clinic to find out a little bit more about the care and support that such patients need. But I think one aspect that we haven't addressed so far is that there's a lot of mental health complications that comes with living with a disease for so long and not being able to have your normal life. If you can't work, your livelihood is gone. So we're going to hear a little bit more after this break to hear, are some people more likely to get long COVID, and just how long is long? How do you know if you have it?
Absolutely. And is there anything in particular that people who have COVID that turns into long COVID are doing that enables them or that sees them developing this form of the ailment? We'll try and unpack all of that for you. As Mia mentioned there, we'll be in conversation with the head of South Africa's only clinic that treats patients who do develop long COVID. You're live on the Health Hub, and we'll be right back.